Not understanding your health isn't harmless. It's one of the biggest reasons people get worse instead of better. And I know that seems strong, but stay with me for a second. Because most people genuinely believe as long as I trust my doctor, as long as I take my medications, as long as I follow the plan, I should be fine. But here's the problem. That only works if you actually understand what's happening in your body. And the reality is, most people do not. And it's not because they aren't paying attention, and it definitely is not because they don't care. But simply put, healthcare moves fast. The information is complex, and most patients leave appointments with just enough information to follow instructions, but not enough to truly understand. And you know what? When that happens, confusion does not just sit there quietly. It starts to affect everything from the decisions you make, the questions you don't ask, the symptoms you ignore, the habits that you keep, and the follow ups you delay. And over time, that gap being between being told what to do and actually understanding why starts to impact your outcomes. And that impact is not loudly and it's not immediate, but it's subtle and it's consistent, and that impact happens over time. Because the truth is, patient understanding is not just a nice to have in healthcare. It's one of the most important factors in whether care actually works. And today, I'm going to break that down for you. And I want to show you, one, how misunderstanding your health affects your outcomes, two, where this shows up in real life, and three, why clarity may be one of the most important things you can have when it comes to your care. So let's start with the simple truth. People act on what they understand, not what they're told, but what they understand. Well, let's think about it for a second. When folks understand why something matters, how it works, or what the consequences are, they engage differently. And healthcare is no exception, all right? So when patients understand what their diagnosis means and why treatment matters, what risks they face, and what lifestyle changes do, they are far more likely to follow through, to stay consistent, and remain engaged. But peep this, when they don't understand, what do you think happens? They hesitate. They procrastinate. They disengage. And it's not because people struggle to commit to things that they don't fully understand, okay? And so now let's talk about this confusions and how it could possibly lead to bad decisions, all right? So let's say that you misunderstand your health. It may lead to some poor decision making, sometimes without even realizing it. For example, medication non-compliance. You may stop taking your medication because, hey, I feel fine. I don't feel anything happening. I don't think I need this. I don't even know what this does, right? And why? Understanding. And that is because you don't understand the purpose, right? There's delayed care. And another thing, you may ignore symptoms because it's probably nothing. So, we'll just wait and see how it goes. I hear you. But why? Why delay these? Why ignore the symptoms? And, it's because, back to the understanding. You don't understand the severity. And then another thing to think about is lifestyle inconsistency. People don't change habits because I don't understand how this affects me, right? And then there's a missed follow up. And then patients don't prioritize appointments because I didn't think it mattered. And then suddenly, misunderstanding becomes, it's not just confusion, but a direct barrier to care. So, let's switch gears a little bit and talk about practicality, okay? Studies have consistently shown that patients who understand their health better, we do the following. We adhere to more treatment plans, we ask better questions, we detect problems sooner, and on top of that, we communicate better with our providers, especially when we detect these problems. We reach out to these teams and be like, all right, so this is happening, what's going on here? And we just ask about next steps and get more understanding to the whys. And lastly, we feel more empowered. And why? Understanding. Understanding creates ownership, and ownership creates engagement. And when patients understand what's happening, hey, we stop being passive recipients of care and start becoming active participants. And you know what? That matters because healthcare works best when patients are involved. Not just present, like, okay, I'm here, but involved and engaged. But beyond outcomes, confusion also affects emotional health because not understanding your health creates anxiety because uncertainty creates fear. There's my favorite 5-letter word. It's actually 6 letters. Stress. Because ambiguity feels overwhelming. And helplessness because we feel powerless, and distrust because confusion can make patients feel dismissed, unheard, and left behind. And over time, many people just start checking out emotionally. Questions, they stop. There's no more advocating. There's no more trying. And it attributes to feeling overwhelmed. And that emotional exhaustion, that also impacts health too. Okay? So, I want to be very clear, and I'm not saying this because patients are lazy. And it's not because patients don't care. And it's not because people are not trying. But the real issue is healthcare. Healthcare was not designed for deep patient understanding. Okay? And I'm going to lay it out for you. Appointments are short. Definitely less than 15 minutes usually in and out. Your labs are good. All right, see you in 3 months. Doctors are rushed. They may end up overstaying an appointment and then have to catch up. And then someone gets the short end of the stick with their appointment, right? Systems are overloaded and antiquated too. And then the terminology is complex, right? And so we patients are often handed these diagnosis labels, these medications, this paperwork and this instructions without real understanding as a result. So, hey, guess what? People struggle. But honestly, this exact problem is why I built Alvora.health. Because, hey, I've been navigating through these healthcare systems for decades. And I've seen how often, we're expected to make critical decisions without fully understanding the whole situation. And, I just kept thinking, how can we make good health decisions if we don't fully understand our health? And, that question, it stayed with me because clarity matters, understanding matters, and patient empowerment matters. Because I believe that better informed patients create better outcomes, right? So, if you've ever wondered, does understanding my health really matter that much? The answer is, oh yes, absolutely. Because misunderstanding your health doesn't just affect knowledge. It affects your choices, it affects your livelihood, it affects your actions, it affects your confidence, and it affects your outcomes. And if healthcare is going to improve, we patients must be empowered with clarity, because better clarity leads to better understanding, it leads to better decisions, and it leads to better outcomes, right? So, hey, if this resonated with you, definitely make sure to subscribe, because I think in my next video, I'm going to talk about, I'm going to talk about how do you know if you're asking the right questions about your health. And let me just clarify, when I say right, I'm just going to say the best questions about your health, the ones that will provide clarity and understanding. Yeah. So thank you for watching. I'll see you next time.